Welcome to Health Facts with Normani Ricks. I am your host, Normani Ricks. I like to start off each episode with a little known health fact. Do you know what an interventional radiologist is? Most people don't. Most people know what radiology is, people who read x-rays, MRIs, ultrasounds, but an interventional radiologist does a lot more than that. I have the honor and pleasure of having Dr. Robert Lufkin on our show today. He is a legend in the field of interventional radiologists. He's been a doctor for over 43 years, and I am happy to have him on the show. Welcome to the show, Dr. Robert Lufkin.
Thanks, Normani. It's such a pleasure to be here with you. I love your program. I've watched your episodes, so it's a joy to be here.
All right. Thank you so much. So I just want to say that I cannot walk into a college or university without seeing your name on a book. So I know that you've authored many books about interventional radiology, reading MRIs and stuff like that. And we're going to get into some recent books that you've written on certain discoveries. So I just want to start with what is your story? How did you get started in the field of interventional radiology?
Yeah, I grew up. My mom actually was a dietitian, so she was a certified dietitian and worked her whole life in hospitals and focusing on nutrition. So I was raised in an environment of following the food pyramid and, the best things to eat, which at that time meant I was raised on low-fat foods. I was raised on margarine. I was raised on, you avoided eggs or egg yolk, anything with cholesterol in it. And what happened was through that experience, one, I became very interested in health. And then I went to medical school and became a physician. And radiology was the field that attracted me because it allowed me to specialize and look at many different types of diseases and different types of specialties. So it's been a satisfying course for me.
Well, I did not know. I guess I was ignorant to the fact that interventional radiologists do procedures. Can you talk about some of the procedures? Because I think a lot of people don't know that.
Yeah, sure. A lot of radiology is basically the interpretation of X-rays, as you know, CT scans, MR scans, ultrasounds, that sort of thing. And that's what the majority of radiologists do. But a smaller portion of radiologists do things called, as you say, interventional procedures, where they actually perform things on a patient. And typically, these are using the imaging studies like ultrasound or CT or MR to guide the procedure. And that procedure may be an imaging guided biopsy. For example, when people have a mammogram and a biopsy from the mammogram, it is directed by the radiologist using the mammogram to guide it. Also, you can do interventional procedures anywhere in the body. A very large area of interventional procedures, in addition to biopsies, are things called angiograms. And angiograms are where a tube or a catheter is put through the arm or leg into blood vessels. And these blood vessels can go all the way to the brain, or they can go to the heart, or anywhere that blood vessels go, these little tubes can go. And then through the tubes, you can deliver treatments. You can send contrast agents, which are things that make the pictures look better when you take an X-ray or CT. Or you can do things that will widen the blood vessel if there's narrowing, say in the case of a heart attack or a stroke. You can widen the vessel or put things like stents in there that will widen them as well. So interventional radiology encompasses all those different areas. I guess the common theme is that the procedures use imaging studies to guide them. And as the radiologist, as the expert in imaging studies, then is sort of the appropriate person to do these guided procedures. Other people do imaging guided procedures. For example, in the heart, many cardiologists do the angiograms in the heart, and sometimes in the brain. In addition to radiologists doing the brain interventional studies, neurosurgeons and in some cases neurologists will also do them.
Okay. So what is the Lufkin pen? I read that you created something for this.
Oh, there was, at one point I was very interested, and I still am, in magnetic resonance imaging, or MRI. It's arguably the single most powerful soft tissue imaging technique that's ever been developed to this date. And instead of just using it to take pictures to diagnose things, we wondered about using MR to guide one of these biopsy procedures with a needle, let's say. And we use a needle to biopsy, as I mentioned, with mammograms into the breast, or with ultrasound into different parts of the body, or with CT scans, and regular needles work fine. The only problem with MRI is that magnetic resonance imaging, as its name suggests, uses magnets, very, very powerful magnets. So the problem with that is if you take a standard biopsy needle and put it in an MR scanner, the needle will be attracted to the magnet and fly away. So it doesn't work.
Oh, wow.
And it creates large artifacts in the image. So to try and figure out a solution for that, we went back to metallurgy and the science of metals and magnetism. And it was discovered, or it was noted, that if you take a stainless steel alloy, which are currently used in needles that produce the big artifacts, what you can do is, if you increase the nickel content in the needles and basically change the alloy, the composition of the metal, it will decrease the artifact and decrease the magnetism to the point that it won't be affected by the MR scanner. So that's basically what we did. We took new special alloys that were high magnetic stainless steel, and we made biopsy needles out of them. And we literally, the first ones, we just epoxied the hubs in and, made them in the garage and sharpened them. And then we began testing them, and they worked to biopsy with an MR scanner, which was never possible before. So we began making these needles, and then a couple of drug companies or pharmaceutical companies that make needles was interested in releasing this as a product, because people all over the world wanted to use these needles, and they kept asking us for them, and we couldn't make enough of them. So the drug companies began to using them, and they put my name on the needle when they began selling it, and you can still get them on Amazon.
That is amazing. That is genius. That is genius. So one thing that I noticed, so I used to be in the Navy, and I lived over in Okinawa, Japan for a while, and I would see different images that they were doing over there, and it looked almost like a picture. It was like 3D imaging and all of that stuff. So I haven't seen that type of imaging in the United States yet. So why are we still kind of doing black and white imaging here?
Yeah, I suspect you're referring to 3D colored rendered images of the skull or the head or different parts of the body. Mm-hmm. And that is available here, and it can typically be taken from a CT scan or an MR scan, which produce slices through the body. And then it's just a matter of putting it into a special computer program that will segment the tissues that you want, and then what's called render them in 3 dimensions. And you can assign color codes to each of those and actually make those images. They are available in the US, but maybe they're not used as much as your experience over there. But it's interesting technology.
Yeah, I thought it was fascinating. So yeah, okay. So I want to get into what you have learned along your journey because you've been a teacher for a long time and you currently teach at USC. So I saw that you wrote a book about the lies that I taught in medical school. So so let's talk about what you've discovered in your 43 years in the profession.
Yeah, an interesting thing, science and medicine is continually improving. And the things that we knew 5 years ago, 10 years ago, some of them were incorrect. And, as we move on, we make corrections and we get better and better. Even the stuff we're teaching today, I'm sure in 20 years or 40 years, people are going to look back and say, well, these are lies I unknowingly taught at medical school. But it's important to be able to continually question the things that we suspect and things that we teach, and always look analytically at science and always look for the evidence, and always ask questions when we do things. So what struck me is that when I initially went to medical school, in the initial part of my training, there were a number of chronic diseases, things like cancer, heart disease, Alzheimer's disease, diabetes, obesity, that were considered largely separate diseases that had separate treatments and were treated separately. Mm-hmm. What's now becoming apparent is that these chronic diseases all have a underlying cause where they're all linked together by underlying metabolic mechanisms. Mm-hmm. And the problem is that these chronic diseases, for the most part, didn't exist 150 years ago. They were relatively rare. And that there are a number of reasons for that. But over the last 100 years, 150 years, these particular chronic diseases, the ones I just mentioned, have begun to increase dramatically in the population. And in fact, in the year 2010, they'd gone from practically zero 150 years ago, now up to 20% of the population the adult population has at least two of these chronic diseases. Wow. And in the last 10 years, till 2020, this number has doubled to where 40% of the adult population has at least two of these chronic diseases.
That's scary.
Obesity, diabetes, hypertension, heart disease, Alzheimer's disease, cancer, stroke. But the fascinating thing is that we're now discovering that these are all linked by underlying factors that we can control with our lifestyle. So that if you do one thing that will lower your risk of getting diabetes, let's say, it will also lower your risk of getting Alzheimer's disease, and also lower your risk of heart disease, and lower your risk of hypertension. And it's fascinating the way these are known. And many people and many physicians are still learning this, or they're not aware of it even. And there are a lot of misconceptions that have been popularized and taught in medical schools over the last few years that are still out there. And that's what I was referring to, sort of with the lies that were unknowingly taught in medical school.
So I think that from my medical experience, like you said, everything was treated separately. So there's a pill for hypertension, there's a pill for diabetes, there's a pill for this, there's a pill for that. But what I'm learning is like sugar and processed foods kind of leads to a lot of these things, and it's being termed or metabolic disorder at this point.
Absolutely. And you've hit on a couple of key points. One is that we have treatments for type 2 diabetes. We give insulin. Mm-hmm. We have treatments for a heart attack. We put a stent in the blood vessel to the heart, which is the coronary artery, and the stent just opens up the narrowing, which is what causes the heart attack. The problem with those approaches are they only treat the symptom of the disease. In other words, if I have a heart attack, you put a stent in my heart to open up the blood vessel, that may keep me alive a little bit, but it doesn't change the underlying disease. In other words, all my other blood vessels continue to keep narrowing. Or if I have type 2 diabetes and you give me insulin, that will lower my blood sugar, but it won't stop the progression of all the other diseases, heart disease, ulcers, kidney disease, all the things that diabetics get. Yeah. And the basis, what we're learning now is the basic root cause of all these chronic diseases is, as you said, it's what are called lifestyle factors, which actually largely depend on a significant effect of the food we eat, which, as you said, processed foods are a big cause of that. Mm-hmm. And if we can avoid processed foods, we see people going off their hypertension medicines, they go off their diabetes medicines, they go off their heart medicines. This should only be done under a doctor's supervision, of course, but it's dramatic what can happen. I mean, I was on 4 prescription medicines for 4 of these chronic diseases. Wow. And by changing lifestyle factors, I was able to roll back and basically stop all the prescriptions, and the diseases just basically went away.
That's an awesome story. I find it interesting that you mentioned Alzheimer's in that group of other things. So how is it related to Alzheimer's? Because that's kind of like the red sore thumb. What's going on with that?
Yeah. All the other diseases that I mentioned, all the other chronic diseases have a medical treatment. In other words, insulin for type 2 diabetes, but those medical treatments don't get to the root cause. Mm-hmm. Alzheimer's disease is unique in that we don't even have a medical treatment that works to change the course of Alzheimer's disease. There are a few drugs, but it's known they don't really change the ultimate course of Alzheimer's disease. So mm-hmm. Alzheimer's disease is particularly the lie or the misconception that was taught in medical schools for many years and is still believed to be the main cause of Alzheimer's disease. And many drug companies are looking at this as the cause of Alzheimer's disease. It now appears that Alzheimer's disease is not necessarily caused by amyloid plaques. And in fact, amyloid plaques, although they occur with Alzheimer's patients, they also occur with other patients. And some Alzheimer's patients don't actually even have them. So they're probably a red herring that's a distraction. What's now understood to be the root cause of Alzheimer's disease is inflammation and insulin resistance, which are the same root causes of all the other diseases that processed foods and other lifestyle factors contribute to. So what we're finding is that Alzheimer's disease, which in the past was not treatable and not preventable, and there's still no drug for Alzheimer's disease that works. What people are finding, though, even with Alzheimer's patients, by changing their diet and eliminating processed foods, and especially going to what's called a ketogenic diet, they're able to reverse many of the symptoms and in many patients prevent Alzheimer's disease from coming on. So Alzheimer's disease is very similar to heart disease and the other chronic diseases in that it has its basis in inflammation and insulin resistance. It's just that it occurs in the brain. Alzheimer's disease has been referred to as type 3 diabetes because it's also driven by these insulin factors that drive diabetes as well. And the risk of diabetes increases the risk of Alzheimer's disease too. But the great message for all of us is that there's certain things we can do in our lifestyle with eliminating processed foods and exercise and specific things we can do with fasting and sleep and eliminating stress. And when we do those, it decreases our risk across the board for obesity, hypertension, diabetes, heart disease, stroke, cancer and Alzheimer's disease. So by doing all these things, we lower our risk for all these chronic diseases.
Okay. So I wanted to ask you, does the brain look different on like an MRI when a person has Alzheimer's? Like, how do you know that it's like inflammation of the brain that causes Alzheimer's? Like, when was that discovery made?
Yeah, well, the discovery for Alzheimer's disease by Dr. Alzheimer was over 100 years ago, and it was based on pathologic descriptions and clinical descriptions originally, and then later on the pathology, in other words, the microscopic analysis of the brain tissue, which even today is sort of the diagnostic hallmark of Alzheimer's disease, those neurofibrillary tangles and amyloid plaques was made. But on MR scanning, there are certain hallmarks for Alzheimer's disease that they're not diagnostic, but they're strongly associated with it. And if you think of Alzheimer's disease, the main symptom for many people is memory loss. And that's the way we suggest Alzheimer's disease, cognitive impairment, but particularly memory loss. Well, there's a part of the brain that controls memory. It's called the hippocampus. And you can look at an MR of the brain, and if you look at the person's hippocampus, you can see it in Alzheimer's patients, it actually shrinks in size, and you can measure the volume of the hippocampus and show that it shrinks in size. In fact, you can look at patients, even patients without Alzheimer's disease, they can have small hippocampi that can appear up to 10 years before the diagnosis of Alzheimer's occurs. So that can be a helpful tool to let them know to start prevention, to prevent so they never do get Alzheimer's, hopefully down the road. But on the MRI, the size of this part of the brain, the hippocampus, is a marker for Alzheimer's disease. Interestingly, on the PET scan, the positron emission tomography scan, which looks at glucose activity of the brain in this particular case, the hallmark for Alzheimer's disease is decreased utilization of glucose in the brain. And the interesting thing is that all of us with aging show decreased glucose utilization in our brain. It's just our brains become more insulin resistant. It's sort of a quote, normal finding of aging, but it speaks to the value of this ketogenic diet. If we switch our diet so that instead of running on glucose, we're running on ketones, and you may have talked about that with your audience, but basically switching to a ketogenic diet not only benefits patients with Alzheimer's disease because it gives the brain energy because you can't use the glucose, but the ketones work fine. Also for regular people, as they get older, this decreased ability of their brain to use glucose can be basically fixed by switching to ketones, and our brains work fine with ketones. And that's why people, when they switch to a ketogenic diet, a lot of times they'll experience, wow, I don't have brain fog anymore. Yeah. My thinking's a lot clearer, and
no, I think a lot of people don't know what ketones are. So can you go into what ketones are?
Sure. Yeah. Our body basically has a metabolic switch that we operate on. It's not only humans, it's also other mammals and other vertebrates and invertebrates, all the way back to yeast. So this is a fundamental biochemical mechanism that basically almost all living things has. And it's a switch. And the switch goes from one side, which is growth mode, it's called. And growth mode is when there's high glucose. When we eat a lot of food and there's high glucose, it switches to growth mode. And that's very useful for young animals for growing up. Your bones get longer, you grow taller, your brain matures. Up till about the age of maybe 25, growth mode is very advantageous to the patient, to the person. The other switch, the other direction, is when there's no food or very little food, the switches the other way into survival mode. And this is maybe I haven't eaten for a while. I don't have any food. So what it does is it mobilizes fat from your body. We all have fat in our body, and we can live for weeks on the amount of fat we have. And that's a natural, healthy survival mechanism. So when the switch goes to survival mode, the fat is then burned instead of the sugar, the glucose. Mm-hmm. When fat is burned, it creates these things called ketones. And ketones are just products of fat metabolism that flow through the body, and they're metabolized by the brain as well. What the interesting theory about this switch is that when we're young, 0 to 25, growth mode is very advantageous. The glucose switch, the growth mode, is very advantageous because it allows our bodies to grow in size and mature and everything. After about age 25, though, the growth mode continues to stimulate our bodies, but we can't grow taller necessarily.
Right. We just grow wider.
We grow wider and heavier. And we also, there's evidence to suggest that this is what drives the chronic diseases and everything, all the diseases we mentioned, and actually drives aging all together. So there's growing evidence to suggest that as you get older, over age 25 or 30, the healthy mode to be in is the survival mode, and running on ketones puts you in that mode.
Okay.
And there's diets you can take that will basically, if you lower processed foods and cut out refined sugars and sugar, then your body will naturally switch into ketosis. And It also happens with fasting as well.
Okay. Yeah. So what I hear you saying is intermittent fasting, decreased sugar and processed foods, exercise, and we know drink a lot of water. So if you do those 4 things, you can eliminate a lot of chronic illnesses.
There's two other things with the diet. You're right on, though.
Let me know.
Yeah, with refined foods are made up, as you said, with high sugar and high processed carbohydrates. So eliminate starches and sugars. But there's also refined fats that are unhealthy, that drive inflammation, and those are called seed oils. Things like canola oil, oils made from seeds. So those are also used in processed foods because they last for a long time on the shelf. So if possible, avoid those. And then for many people, grains are a problem also. Certainly
is it because of allergies? The grain, you have an allergy to it, which causes inflammation. Is that correct?
Yeah, there's gluten sensitivity with a disease called celiac disease, which you can test for. But there's growing evidence that a lot of people may not have full-blown celiac disease, but they are sensitive to the grains, and the grains cause inflammation. So it's something you can experiment with in your diet to even cut back on the grains. So that's one other thing. But you hit on all the high points there. Those are the good things to do. The intermittent fasting is great. All those things.
Okay, awesome. So, Dr. Lufkin, how can people get in touch with you, and what can you offer them if they do get in touch with you?
Well, my website is just my name, robertlufkinmd.com. We have a podcast that people can listen to on there, a weekly podcast with information. We also have a Metabolic Health Summit that's a free summit. That information is available on the website that people can attend. That will have 40 speakers, actually 60 speakers that will be interviewed with all different topics about their views on the latest in metabolic health, largely talking about all the things that we talked about today here.
Okay. What is the name of the podcast?
The podcast is called Health Longevity Secrets.
Okay, there we go.
And I think if you just search for my name, you can find it in there on anywhere Apple podcasts are.
All right. Well, I just want to thank you so much for being a guest on Health Facts. And I want to thank you for everything that you've contributed to the profession over 43 years and lots and lots and lots of articles and books and documents. And everybody can find them at their universities and colleges. So thank you so much for everything that you've done throughout your years.
Thanks so much, Normani. It's an honor and a pleasure to get to know you better and be on this show. Look forward to doing it again sometime.
All right. Thank you so much.